I thought I would show you a side-by-side comparison of kind of a normal knee to one with trochlear dysplasia tri-compartmental osteoarthritis. So on the left side, this knee just had one knee surgery when I was 7 or 8 years old. I'm 49 now, and I had a lateral release going up and down. My range of motion is 0 when it's flat, and then bent it is 135. On the right side, I have had 3 lateral releases, synovectomy, imbibement, and reefing. And that all started at the age of 11, 12. My last surgery on this knee was in 2015. I've had close to 30 to 40 subluxations, dislocations, falling all of those times. So at this point, I'm getting a total knee replacement, right knee. Range of motion on my surgical knee is 3. I'm at 3 degrees, so you can see the difference between flat, or I'm even almost hyperextended, flat and 3 degrees. And then bent, I am at 125. I have been at 130 in weeks prior. Just it was maybe a little swollen that day. So I'm also wanted to show you, when after surgery, it needs to be fully extended after surgery. So nothing under that knee. So that's why I'm kind of playing around with different types of pillows that I've got. This knee doesn't really give me a ton of issues. I have some meniscal pain. It's taken the brunt of my entire life. But as you bend it up, it kind of just goes up and down. It's a little bit of a flip there. It doesn't really bother me. This knee, however, this is where you're going to see that kind of go in and out. And that actually does not hurt. But it also is not going completely back in. You can see this hollowness. The kneecap is sitting kind of over to the side. And then I have this really sharp edge over here where the kneecap is kind of protruding out. I think some osteophytes or calcium stuff going on there too. So that's where you can see kind of the difference in why I'm needing a new knee, because we're done. It's done its job. It's done the best it can for all my life, and it's done. So I think it's important to also call out when a kneecap actually subluxes or dislocates, it's actually going further out than this. The way that it feels is that it comes out, and I describe it as a chukunk, like a gunk, and then it's getting pulled out. And so when that happens, your leg or my leg paralyzes. So you cannot now bend your leg because the kneecap is completely out. Mine eventually goes back in, and then of course I can resume motion. But that is the importance of the kneecap. So if it is out, you cannot do this. Thus, I fall because your instinct, right, is to, if you trip, is to then put that leg out again. You're going to catch yourself, but you can't. And you just topple. I mean, there is no saving yourself when that happens. You're tripped with this leg, and you can't do anything with it. You can't move this leg out. So it's a recipe for disaster. So I can remember falling down the stairs when I was 4 or 5. My parents would be like, "Stop falling down the stairs." I'm like, I can't help it. I don't know what's going on. It's an external situation. I don't just fall. It's something where I turned my ankle a little bit. I kicked something. I brush my knee against something. At this point, that hasn't always been the case, but it doesn't just dislocate on its own. It's something that generally I miss or don't see, something like that causes it to happen. So, and you're not perfect, so I can only control what I can see. So yeah, I thought there's the education on Erica's knees and why I need a new groove.